We talk a lot about the gut-brain connection, and it is a very real thing. But an interesting study just came out. I recently did a video talking about LPS or endotoxin. And basically what that is appreciating the fact that your intestinal tract, your gut, is considered outside your body. So, you have to think about that for a second to see how that makes sense. But from your mouth to your anus is a closed system. So it is outside the body until things pass from your gut into your bloodstream. Now, the beauty and intelligence of your gut is that when things are bad, like a bad bacteria or a parasite or a toxin, when they're bad and you have a healthy gut, that's why 70% of your immune system is housed in your gut. That gut immune system says, no, 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 you can't come in. You can't come into my house and I'll just poop you out and off you go. And that's how the gut is designed. Or the body just attacks it where it is. But regardless, it doesn't let it in. So when we're talking about the gut being outside, it's because when things go inside, that means it's leaving the gut and going into your bloodstream, which of course is what our food does. So we break down our food adequately, and then again, the gut's intelligence says, oh, you're a good guy, come on in. And so there's literally this gatekeeper system of, nope, you can't come in, to, yeah, you're welcome. So that's number one. So we talked about the fact that if these bacteria just stay in the gut and they're pooped out, or the immune system breaks them down, no big deal. But when the immune system has been compromised a bit, then these endotoxins from these breakdown products of bacteria get into your bloodstream, then we're in trouble. Then we have a lot of inflammation, which is leading toward all the diseases we don't want, like heart disease, obesity, diabetes, autoimmune disease, Alzheimer's, etc. And it's very important to, of course, have an intact gut, not a leaky gut. But what was interesting about this study is it really spoke to the gut-brain connection, because what they did was they took human volunteers and they injected the LPS directly into their bloodstream. So these were brave souls that said, okay, sure, inject some bacteria right into my bloodstream, and then they watched to see what happened. So not surprisingly, their inflammatory markers rose, showing that the immune system was like, whoa, where did all this come from? And of course, when that happens chronically, that's when it leads toward the diseases that I was just discussing. But also, with that brain connection, their mood changed, their motivation to do anything changed, and then socially they withdrew. They didn't want to, engage with other people, etc., etc. So really proving, and that's what I loved about hearing about the study, because we've kind of known and we talk about it a lot, but this was a study that really proved it. So a lot of times when I talk to patients, they're like, well, I've heard about the gut-brain connection, but, we're still kind of wedded to the fact that the brain is this, thing unto itself, and how could it be affected by what we eat or the quality of food that we eat? But it very, very much is, and this study proved it. So if you're having some mood issues, if your motivation is low, if you feel a little withdrawn, anxious, depressed, etc., looking at that gut is a really strong, really very impactful way to move forward in your health, and not just focus on the brain and doing things like antidepressants, anti-anxiety medications that have a lot of side effects, but standing back and appreciating that gut-brain connection is very strong. I would also throw in hormone levels, but that's a topic for another video. But hopefully you got something out of this. If you did, give it a thumbs up. Subscribe to the channel so more people can see what we do. And if your health needs to be improved, please reach out to the clinic. Our telephone number is in the description of the video, and we would be delighted to help. I'll talk to you soon.